Have you ever really thought about it? How does that cookie you just ate, or maybe an apple, actually turn into the energy you need to, say, walk up a flight of stairs? It's this incredible, complex process, and today we're diving deep into the two master regulators of your body's entire energy economy, your pancreas and your thyroid. So let's get right into it. Right? So this is the central question. How does that cookie or that piece of bread become the literal fuel that powers every single move you make, every thought you have, even your breath? Well, it's this amazing, intricate dance between hormones and cells, and we're going to break it all down for you, step by step. Okay, so at the very heart of this whole energy equation is your endocrine system. You can think of it like the master control panel for your entire body. It's this network of glands that pump out hormones, which are basically these tiny chemical messengers that travel through your blood, telling your cells exactly what to do. And, when it comes to managing energy, the pancreas is one of the biggest players on the team. Now, the absolute star of this whole show is a hormone called insulin. And to really get how it works, I want you to picture it as a key. Your cells are like millions of tiny locked houses, and they need fuel to run, right? But that fuel, called glucose, is stuck outside. Insulin is the key that unlocks the door and lets that fuel right in. It's a simple but super powerful analogy, and we're going to keep coming back to it. So, when your body is working just right, this whole process is unbelievably smooth. You eat something, your body breaks it down into that sugar we mentioned, glucose, and the glucose hits your bloodstream. Your pancreas senses this, and bam, it releases insulin. That insulin then zips over to your cells, acts like that key, unlocks the door, and lets all that wonderful glucose rush inside to be used for energy. It's a perfect self-correcting system that keeps everything running like clockwork. But what happens when this perfectly tuned system goes completely haywire? What happens when there's way too much sugar floating around in your blood, or maybe not nearly enough? Well, that's when things can get pretty serious, and that's exactly what we need to talk about next. So you've got two opposite ends of a very dangerous spectrum. On one side, you have hyperglycemia, that's high blood sugar. This is where way too much glucose gets stuck in your blood, usually because there aren't enough insulin keys to let it into the cells. And over time, that is incredibly damaging to your organs. Then on the other extreme, you have hypoglycemia, low blood sugar. This is a full-blown immediate crisis where your brain and muscles are literally starved for fuel. It can lead to seizures, a coma, or even worse. Both are incredibly dangerous, and understanding the warning signs is just crucial. Now, these states of high and low blood sugar are really at the core of the condition we all know as diabetes. But here's something a lot of people don't realize. Diabetes isn't just one single thing. It's actually two very different conditions with two very different stories. All right, so let's get this straight, because the difference is everything. In type 1 diabetes, the body's own immune system goes on the attack and destroys the cells in the pancreas that make insulin. So if we go back to our analogy, the body literally stops making the keys. There's an absolute lack of insulin. Now, type 2 is a different story. The body is still making insulin, but the cells themselves have become resistant to it. It's like the locks on the cell doors have gotten all rusty and just don't respond to the key anymore. And eventually, the pancreas just can't produce enough to keep up. This is a huge deal, because it's why type 1 absolutely requires lifelong insulin therapy, while type 2 can often be managed at first with lifestyle changes and oral meds. But here's the really scary part. Even though their causes are totally different, both types of diabetes, if left uncontrolled, can lead to the exact same devastating long-term problems. Why? Because having chronically high blood sugar is like a slow-acting poison that damages your blood vessels all over your body. And this leads to a whole host of awful stuff, like heart disease, strokes, kidney failure, nerve damage, even blindness. This is why managing blood sugar isn't just a good idea, it is absolutely essential. Now, I know that all sounds incredibly scary, but I want to be crystal clear about something. There is hope. This is not a death sentence. With the right strategies and a solid healthcare team, people can manage these conditions and live long, vibrant, healthy lives. It's all about finding that path back to balance and giving your body the support it needs. So we've talked a ton about the pancreas and blood sugar, right? But there's another major player in your body's energy economy we have to bring into the conversation, your thyroid. If the pancreas is managing the immediate fuel supply, the sugar, then the thyroid is kind of like the thermostat that controls the overall speed of your entire metabolism. And honestly, that is the perfect way to think about it. Your thyroid gland pumps out two key hormones. You'll see them called T3 and T4, and they basically act like the gas pedal for your body's engine. They travel to every single cell and tell them how fast to burn energy. This controls pretty much everything: your heart rate, your body temperature, how quickly you digest food, the whole shebang. So, what happens when this thermostat goes wrong? Well, if your thyroid is overactive, that's hyperthyroidism, it's like the thermostat is cranked all the way up to 90. Your metabolism is racing, leading to things like weight loss, a rapid heart rate, and anxiety. On the flip side, if your thyroid is underactive, hypothyroidism, it's like the thermostat is set to freezing. Your metabolism slows to a crawl, causing weight gain, fatigue, and depression. And here's a cool thing: doctors can check your TSH level. That's a hormone from the pituitary gland. If TSH is high, it means the pituitary is yelling really loud at your thyroid to get to work, which is a sign your thyroid is underactive. So you can see, whether the problem is with your blood sugar or your metabolic rate, the name of the game is exactly the same: restoring your body's natural state of balance. So let's take a look at how that's done. Look, managing diabetes is a multi-front effort. It almost always involves a mix of strategies. For a lot of folks with type 2, simple lifestyle changes, we're talking diet and exercise, can make a world of difference in helping the body use its own insulin better. For others, oral medications are needed, and for some, insulin therapy is the answer. The key thing is working with your healthcare team to figure out the exact right plan for you. And managing your body's energy is a real balancing act. There's this phenomenon called the Somogyi effect that just perfectly illustrates this. What happens is, if your blood sugar drops too low while you're asleep, your body can totally overreact. It panics and releases a flood of stress hormones that then cause your blood sugar to be sky high when you wake up. It's this wild physiological rebound that shows just how delicate this balance can be. So what do you actually do in that immediate crisis of a low blood sugar? There is a super simple, potentially life-saving protocol called the Rule of 15. First, you check and confirm your blood sugar is low. Then you treat it with about 15 grams of a fast-acting carb. Think 4 ounces of juice or some glucose tablets. Then, and this is the most important part, you wait 15 minutes. You wait. Then you recheck. It's so important not to overtreat and send your sugar soaring. You just repeat that simple process until you're back in a safe range. Living with a chronic condition like this can feel overwhelming, for sure. But it's also a chance to take control of your health in a really powerful way. Things like consistently checking your blood sugar, doing daily foot checks, getting regular eye exams, these aren't just chores. These are tools for empowerment. They're acts of self-care that allow you to partner with your body and live a long, healthy, awesome life. And here's the bottom line. Your body is this amazing, resilient system that is always striving for balance, for equilibrium. The whole goal of managing these conditions is just to support it in that natural goal. It really is a marathon, not a sprint, and every single small, healthy choice you make is a huge step in helping your body in its constant quest to find that balance. And so that really leaves us with one final question for you to think about. Now that you know your body is this incredible system that's constantly looking for balance, what is just one small change, one tiny thing that you can do today to help support it on that journey?